it is Kyra and I am back again with another video. So I'm going to try and do a medical assistant day in the life filmed on my phone just so I can get it up quicker for you guys and edit it, and also because I can't find the charger for my mini camera battery right now, but that's a totally different story. So anyway, I just got dressed and I put on my, oh sorry, I got the salad sitting right here, y'all. I was just eating that. Okay, so I put on my scrub top, I put on eyelashes and then a little eye makeup, and I did my eyebrows, but I didn't put on any foundation because call me delusional, but I think my dark spots are kind of starting to go away, which is really the only thing I was worried about. Like, I'm trying to get better skin, but I think they're starting to go away. Like, COVID really just brought it out in me, and I don't know why. Like, it's still there. This is really what I was worried about. Still there, but I swear it's fading. I swear. Okay, you guys, so when I was at work today, my doctor had a toenail removal, and this is just me showing you guys the aftermath. Usually it looks worse, but I guess he kind of did some cleaning. But for the most part, as an MA, you guys have to deal with setting up for procedures and then also cleaning up afterwards, which I feel like a lot of MAs may not talk about here on YouTube, but y'all, it's part of the job. And it kind of sucks when you have patients waiting in the waiting room, but you literally cannot room them because the room may look like a crime scene after some procedures. Like if you're suturing or whatnot and it starts like a lot of blood or something, it may literally look like a crime scene. So yep, this is just me cleaning up this room. This one wasn't as bad, and I find that when my doctor, when he hosts medical students, sometimes the cleanup isn't as bad because they feel like this weird responsibility to like clean up some stuff, or they'll ask like, hey, do you need help with anything? And I'm just like, you're studying to be a doctor. I am a MA. Trust me, I'm used to this. And once you're a doctor, you will understand that you do not have to help your MA. And you guys, I've seen some MAs talk about how horrible doctors are they work for, but I am lucky that I actually like my boss and I can talk to him. So I actually asked him after this, like, what was the reason that you had to move the whole table? Like, seriously. And he laughed and he was like, well, I can push it back for you. And I was like, no, don't worry about it. I can push it back, even though it's a lot of work. But yeah, I'm just happy I have a boss that I can talk to. So this is the tray afterwards. It's pretty disgusting. And then I realized I really didn't need to pick the stuff up because I could just remove the pad. But I don't know what I was thinking when I was trying to show you guys. And then at my clinic, MAs are responsible for like rinsing off the tools that their doctors use. But then I put them in like this little container for the MA that's in charge for the week to sterilize them in the autoclave. So that's one good thing, because it would take so much time if I had to prepare these to go in the autoclave. But no, I just have to rinse them off, make sure there's no blood on them, and then I set them to the side to prepare for the person that's doing the instruments for the week. Day 2. Anyway, so I am stuck between no space on my phone and never being able to find the battery charger for my camera. So I'm like, I don't know what to do. It makes everything harder, and I already got enough stuff to stress about. So I'm just eating oatmeal. That's what I've been eating lately. I really like it, but hopefully today is an easy day. But let me check the schedule and see. That'll determine really if it's gonna be easy or not. It looked like it's kind of popping. Okay, guys, so here's me coming in. I always push my card in before I prepare for a patient to grab a patient to come in. And then also, I don't know why, but my laptop is just always dying. I'm getting better about having it hooked up to the charger when I'm not using it, but it's just so hard. And then obviously I'm using it all day, so it's just hard to keep a charge. So sometimes I do have to plug it in. This is me being kind of stupid. I plug it in all the time and I still can't figure out where. But yeah, okay, this is me. Actually, no patients for once. Okay, so it's Friday. Just got to get through the last day of the week. Trying to do this, but like my allergies are really acted up. I literally can't take anything because last time I tried to take like Zyrtex, it made me so sleepy. I literally fell asleep in my chemistry lab, and that can't happen. I just don't have the time to sleep. Like, sleep is for the weak. So anyway, I'm suffering through it. I had a chemistry lab last night, so that's why I'm super tired. It was actually pretty easy, and I worked with a different person than I normally do because my lab partner, he's just been so flaky lately. Who knows where he's at, what he's doing with life. But anyway, so one of his friends kind of had told me like, oh, he had COVID a few weeks ago, that's why he wasn't coming. And it made me upset because he basically like lied to me and told me that he had COVID months ago, and then come to find out, no, you had COVID last week and that's why you weren't here, and you weren't fully honest about why you weren't there. So I don't know. Anyway, that's neither here nor there. Let's try and just make it through the day. You guys, so I keep saying I'm going to decorate this cart and I never do it. So I got this huge thing of hand sanitizer. It's supposed to be in my EKG room, but since we're not doing any EKGs today, I brought it here because of my allergies. I'm just sneezing and I feel really stuffed up. I'm like, I've been faithfully using this after every patient just to like keep them safe. I got my manual stuff because for some reason I've been having, oh sorry, I don't want y'all to see patient information. Oh, well, y'all didn't see that chart. I don't think so. This is just sad. Anyway, so I've been having issues with this, so that's why I've been. Okay, guys. So obviously it is after work, and I have changed. I'm sitting in my car right now. I'm supposed to be in class. Y'all always talk about my chemistry lab, but I do have one other class that I go to in person. The other ones are all online. So just my chemistry lab, and then this math class I go to in person as well, which was a mistake. I should have took this class online. It's so annoying. Like, this class is literally so boring. It makes no sense. It's just basic algebra, so it's nothing like that's too hard or anything. So most of the time he'll give a short little lesson, then after that you have to work. But the work, like, he will give us, and I'm not complaining because some people might need it, he'll give us like 2 weeks to get like not a lot of work done, like work you can finish in 2 or 3 days maybe. So most of the time you're just kind of sitting there if you finished everything, and you can't leave because he does this thing where at the end of the class you have to answer like 2 or 3 questions. They be little basic either math questions, or sometimes he try and be funny and it'll just be random questions like what's your favorite song or something. And I'm just like, sir, like, I could have left 2 hours ago to be answering these kind of questions. So I don't know, I was literally just falling asleep in there. I'm already finished with most of the work, and I was just like, you know what, let me come outside. He already said he's gonna post the end questions at 3, so I'm gonna sit in my car for a little bit, and then I'm gonna go back in close to 3, answer the questions, and go home, because my apartment is a mess and I need to clean up. But this is an MA vlog, so you guys don't care about this. I just want to say I will catch you guys in my next video.